It's the third time.
Code blue. These are never the words you want to hear in the hospital. Code blue means that a patient went into cardiac arrest. It can be something as simple as a medication error. Medication errors are becoming more prevalent in the hospitals today and must be recognized. As a future nurse, I've been researching medication errors for the past 3 years and have a little bit of knowledge on the subject. First, we're going to start off with defining a medication error, how they occur, how we can prevent them, and how it's going to benefit to know. The definition of a medication error is anything that can happen between dispensing the drug from the prescription to administration of the drug, anything in between. It can happen from the pharmacist, the nurse, or the doctor. A medication error can be as simple as the room is too noisy when the nurse is preparing the medications and she grabs the wrong brand of the drug. Also, many drugs have very similar names. The generic names can only be differentiated between 1 or 2 letters and are very easily mixed up. Also, when they are written, medications, if they do not have a leading 0, they can easily be mistaken for a different number for the dosage, which can, of course, be the wrong dosage of the medication and be harmful to the patient. Another problem that we see is the wrong patient. If you have 2 patients on the same floor with similar last names or the same last name, they're easily mixed up, and of course, the wrong medications can be given. Now, how do we prevent the medications as a concerned person? First, we should double check our medications. Always have another nurse or another pharmacy tech look over the medications and make sure you're giving the correct ones. Also, have another nurse or pharmacy tech check the medication dosage. Pharmacists are the ones that configure the medication dosage and determine if it is correct for the patient, but if you feel that it's not correct, it's always best to recalculate it yourself to make sure. If it is incorrect, calling the pharmacy is always the best choice. Use 2 patient identifiers. When walking into the room to give the patient the medication, always checking for their birth date and their name is the best way to make sure that you're not giving the wrong medication to the wrong person. Now, how are we benefiting from this information? If you're a patient in the hospital and someone comes in and says, Mrs. Smith, here's your medications, and you're not Mrs. Smith, you need to notify them. You need to make sure that they're not thinking you're a different patient than you are. If you feel like this is not the normal medication that you have at home, of course the nurse should be notified, because usually you're right. Medication errors can happen to anyone. No one wants to hear a code blue over the intercom. Therefore, as a future nurse, I plan to take this information and apply it to my own course.
3 to have